We have been fighting constantly now over this Medicare, Medicaid thing. It's what's in the news. It was the biggest crux of the big, beautiful bill is that we're making these cuts to Medicare, Medicaid. And what's getting lost in this conversation, as usual, is the fact that Medicare and Medicaid is the perfect government analogy for I'm going to break your legs, then I'm going to give you a wheelchair, and then I'm going to expect you to thank me because you can get around now. Government broke healthcare. Government is the reason healthcare is so expensive. Nope, sorry, it's not these evil insurance companies. It's not these big corporate hospitals. It's none of that. Nothing that's happening in the private market is the reason for this. All of what's happening in the private market is a response to the incentives created by the state. Okay, it's all the way back to FDR. I've done about 50 freaking videos on this. When he exempted benefits from his wage freezes back in the 30s, which essentially created the system, the modern insurance in between the care provider and the consumer and employer-sponsored healthcare. FDR created that system. Throw on top of that Medicare, Medicaid, throw on top of that certificate of need laws, throw on top of that evergreen patents, throw on top of that 50 different states having complex regulations about what it takes to produce and distribute health care and health insurance within their states, on top of all the federal regulations, and then go, oh my God, look what capitalism is doing to health care. This drives me nuts. I just watched a video by More Perfect Union, those idiots over there. And they talked about private equity coming in and buying up a hospital and shutting it down. And the first thing the lady says is she's like, well, this is what happens when you allow the market to function. The idea that we have anything resembling a market-based economic system in healthcare, you have to either be a moron or just okay with flat out lying to your audience. If you point to the issues we have in healthcare and think that that has anything to do, or that the healthcare marketplace in general has anything to do with free market economics. It is the most regulated system in the country, and the largest consumer of healthcare in this country is the government already. Already the government is the largest consumer of healthcare in the country. Between Medicare, Medicaid, and the Veterans Association, government's the largest consumer. This entire system was created by the government, and then people look around and say, well, it's complicated to understand why it's so expensive. It's a lot easier to blame profit, blame the market, these invisible boogeymen, and say, just let the government do more and we'll solve this problem. It's the same thing with housing. It's the same thing with food. It's the reason so many young people are getting sucked into the idea of socialism and communism, because our government has done such a great job, and the left and progressives, whether they are intentionally being manipulative or they're just useful idiots who are regurgitating what Rachel Maddow told them on MSNBC, those people have convinced an entire generation of Americans that it is free markets that are causing their problems. It's not the free market that's devaluing your currency. It's not the free market that's regulated healthcare out of your affordability range. It's not free markets that create zoning laws and all kinds of other restrictions to building and constructing rental properties and new housing to keep the market fair and competitive. Let me just explain, wherever you see a high amount of demand and high prices, and you don't see suppliers coming in and producers coming in to meet that demand, I can guarantee you will find a litany of government rules and regulations and interventions that are preventing that from getting to you. And that's how you end up with this guy, Mamdani or whatever, in New York. We're going to have city-operated grocery stores because food is so expensive. Well, let me ask you a question. Who in the food pipeline, who in the food chain of command or distribution network, chain of command, who in the food distribution network is to blame for high prices? Who needs to be squeezed in this production and output system? Is it the farmer? Is the farmer making too much money? Is it the grocer and his 1% to 2% profit margins? Is it the trucker? Like who along the supply chain do we need to squeeze to get more from? So here's what's going to happen. Let me explain to you exactly what's going to happen with city. Hopefully he's not able to pull it off. Although part of me wishes he could, so that we could see how quickly the whole thing comes unraveled and how difficult it becomes for New Yorkers to access food. Because the first thing he's going to do is set price controls in the city grocery stores. He's got to set price controls, or what's more likely is he'll take a massive amount of, he'll give the city grocery stores, obviously will have an unfair advantage because they won't have to pay property taxes, which you could just tell anybody who's selling groceries, you don't have to pay property taxes anymore, but we're not going to do that. That doesn't lead to more government. So it'll start out as a massive taxpayer subsidized program where you're going to tax the crap out of people and give the city-run grocery stores this massively unfair advantage. You're going to have all these great low prices. You're going to force the private grocery stores out of business. And people are going to start questioning why their city taxes keep going up to fund these grocery stores. And they're going to recognize that they're not actually saving money. It's actually costing them more. So what will happen is that the government then can't admit that they made a mistake. And since all the private grocers are not out of business, what they'll have to do is negotiate price controls. And guess what price controls do? Price controls create scarcity. I'm telling the people of New York, you better get like some kind of public transportation seasonal pass or whatever. You better figure out how to get yourself out of the city and into the suburbs, because that's where you're going to have to go to buy groceries. New York City will be the biggest food desert you've ever seen. But I'm straying off point here. Shortages and high prices in the market are not caused by profits. They're not caused by billionaires. They're not caused by corporations. It's caused by government interference in the market, period. And that applies to corporate taxes. That applies to tariffs. And it applies to regulations. All of these things make stuff more expensive. And so we argue over why people can't afford stuff. And we say the government should come in and solve this problem without recognizing that it was the government, in fact, that created this problem.